Hey mama, welcome to this video on things I wish I knew before my first trimester. Before we get started, I am Annabelle. I am a nurse, health expert, and a mama for Pearently. And I would love for you to click the link below to download our Power Pregnancy workbook. This is an overview of some things that maybe you want to know before your trimester begins. So let's jump into this video, things that I wish I knew before my first trimester. I hear this question a lot. Many women don't know what to expect. So let's jump into these 5 things that I think that you might want to know before your first trimester. Number 1, you find out you're pregnant. You call your OBGYN and say, I need to be scheduled for an appointment, and you think it's going to happen right now. And they say, okay, I'm going to put you down for this date and time. And it's so many weeks away, and you think, but I'm pregnant. Shouldn't I just come in today? What am I supposed to do till then? Well, what I'm trying to say is that your doctor or your midwife might not schedule your first OB visit until you're about 9 to 12 weeks pregnant. For me, I was 10 weeks when I went in for my first OB appointment. The doctor wants to make sure that your pregnancy is valid, that nothing happens. Doctors are busy, they don't have a lot of time slots. And at your first OB visit, some doctors will do the first sonogram. And so they want to wait till you're a little bit farther along so that when they do the sonogram, they can see this is a viable pregnancy. So don't be discouraged. Don't think that you need to go find another OB. It is normal for OBs to not schedule you until you're about 9 to 12 weeks pregnant. Second thing I think that you should know before your first trimester is gestational age. So how is this calculated? It's not always calculated how you think it is. Some doctors calculate it differently, but most doctors calculate your gestational age based on your last menstrual period. Now you're thinking this is kind of weird. I wasn't pregnant when I was bleeding, so why are they calculating it then? Well, historically, we didn't always have the technology that we have today, and that was the most accurate way to calculate when a baby was conceived, because they know you're not pregnant when you're bleeding, and so the pregnancy had to have happened sometime around your menstrual period. So obviously you probably didn't ovulate until what the textbooks say, 14 days after your last menstrual period. So your gestational age is going to be give or take 2 weeks, but we still, as healthcare providers, calculate based on your last menstrual period. And pregnancy gestational age is 40 weeks long. Let's move on to number 3. And I think that you should know that at first, when you find out you're pregnant, you're probably going to be excited, especially if it was a planned pregnancy. And you think that excitement's just going to last. So by the time you find out you're pregnant, you are probably around 6 weeks. And you think, man, I feel great, I'm pregnant. And then you start to feel bad. Now your first trimester, by the time you find out that you're pregnant, you're already about halfway through your first trimester, because a trimester is 13 weeks, and you probably found out you were pregnant around week 5 or 6. And you're excited, and then all of a sudden it hits. You have nausea, you have mood swings, you just want to sleep all the time. And you're thinking, what happened? I'm pregnant, I'm supposed to be feeling great. I mean, people say that you kind of feel sick, but I feel terrible. Well, be encouraged. First trimester, like I said, is already about halfway through. And by second trimester, you're going to start feeling great again, excited, you'll have energy. So know that it was normal to be excited at first and start to feel a little bad later on. So speaking about nausea and feeling bad, number 4 I want to talk about is morning sickness. Everybody says it's morning sickness. I'm going to wake up and feel nauseated, and that's not the case for everyone. So I want you to know that you might have morning sickness, morning nausea. You might have it in the middle of the day, and you might also have it at night. That's when I had it. I woke up feeling okay, but by bedtime, I was feeling very nauseated. So what do? Well, it's not always encouraged to eat right before bed, because as you're pregnant, you will also experience acid reflux and some heartburn. And so if you eat right before you go to bed and then lay down, then that's just going to make it worse. So the best thing to do for night sickness, at least for me, is I bought ginger root. And I would cut off a piece of ginger root and chew it up, and it would help the nausea a little bit. And then I didn't have to worry about having acid reflux because ginger also helps with digestive problems. Any sort of acid or anything sitting in your stomach, it really will settle your stomach down. So I definitely encourage that. If you do want to have a small snack before bed, I would encourage nothing greasy. Blue corn chips are great for nausea, so you can do that. Some bone broth, just to kind of soothe yourself. So just a few things you can do if you end up having night nausea or night sickness instead of that morning sickness. Now, into the fifth thing that I think will be helpful to you before your first trimester is teeth. So people don't really talk about this too much. I have very healthy teeth, and I did not expect to have any problems with my teeth. But I did. I had plaque buildup, and my enamel was starting to look a little bit weird, and my gums were bleeding. So what's the deal? Well, with pregnancy, hormone changes will definitely affect your teeth. You have increased blood volume, which can cause the bleeding of the gums. You will have maybe a lot of vomiting, and so there's a lot of acid in that vomit that can cause the enamel to erode. You can also the constant acid reflux can cause teeth erosion, specifically the enamel. And then also you're at increased risk for gingivitis. And gingivitis, with that in mind, you'll definitely want to go see your dentist and talk to your healthcare provider about it. But there are ways to make sure that your teeth stay healthy. I delivered my baby, I still have my teeth, they're okay. What I had to do was I had to start brushing more, and I had to brush very gently. Just because you're brushing more doesn't mean you need to brush aggressively. So make sure that you have a soft bristled toothbrush. I bought an electric toothbrush while I was pregnant because I was starting to brush too hard, and that hurts my gums. It will hurt your gums. So make sure that you're just not brushing too hard and that you have a good toothpaste. So I specifically used Tom's anti-plaque and whitening toothpaste, and I would brush 3 times a day. Make sure also that if you eat any sort of sugar, and I would definitely recommend reducing your sugar intake while you're pregnant because that sugar can cause even more problems with your teeth. But make sure that you brush right after you eat sugar, especially if you eat any before you go to bed. And also just try to keep your acid under control. Make sure you see your dentist. So if you want to keep your teeth looking nice, make sure you do these things and that you're aware of them. So these are your 5 things that you might wish that you would know before your first trimester. Also, I want to remind you to click the link below to download our free Power Pregnancy workbook. I think it'll be super helpful to you, and we would love to see you on Pearently soon. All right, have a good day, ladies.